Thyroid. That's a big topic.
Yeah, it's kind of a loaded topic, I think,
Yeah.
because I think that it's something that people are curious about a lot. People are hearing a lot about it. And there's a lot of, I think, different philosophies of providers on how to manage thyroid and how to treat thyroid. And they all are very different. Like there's certain providers, I think, that are much more conservative and they would be willing to be like, oh, well, unless you have like levels that are like this for a long period of time, then we're not going to treat. And that's when people become very symptomatic and very frustrated. And then there's providers that I think are a little more like us that are more like, okay, let's look at things when they're only this much of a problem and start working on it so that way we don't ever get to this level with it. And that's something that's changed for us over the years, I think, as
Yeah.
we've gotten more knowledgeable about it.
Yeah.
Would you say?
Yeah. But I also want to start like, I mean, people, of course, you can Google and you can look it up and see what the symptoms are. But from your experience after, even before and after the training, what are the biggest symptoms that somebody, if they have, they can question and maybe I need to get checked my thyroid checked. What are basic symptoms and what's the things you have seen between male and female, and we can jump into not specific because those are
Yeah,
more
I mean, because every person
we do those in
manifests
the
a
morning
little
during the appointments as
right.
far as what numbers to look at and labs value to look at. Those are more stuff we go in appointments kind of thing.
Yeah.
But what are the symptoms that people have told you that makes you like, huh, you need to get your thyroid checked?
I'd say fatigue is a big one
Mm-hmm.
with it. So just overall fatigue, like that you never feel rested, you never feel like you can recover no matter how much you sleep, that you're just always drained with it more than you feel that you should be for whatever your current life situation is. And I think that's often a symptom that people kind of push away, especially I think in early parenthood, like the phase we're at where we have young kids, like you're going all the time. And people are like, oh, well, that's just normal parenthood. Well, may not be with it. It may be that that's more exacerbated than it needs to be. So I'd say that hair loss, hair changes, where hair is more brittle, it's not growing in quite as much, where you feel like you're losing hair a lot. That's a big one. Feeling cold all the time, achy, for underactive thyroid. Weight that just doesn't come off, or you feel like you're always gaining weight no matter what you try with it. Just kind of those metabolic pieces with it. Stomach stuff, like if you have constipation a lot, nausea a lot, you're just not hungry. Basically, you feel just kind of like schlumpy all the time. It's kind of like the way that I normally describe patients. I'm like, you just feel like you feel schlumpy, and they're like, yes. How about you?
Other ones that I don't know if you talk about brain fog, focus, and some people may misdiagnose as ADHD, mood swings, mood changes. Some people may misdiagnose as bipolar. That's a big deal. So you can have anxiety, you can have depression, it can affect your menstrual cycle. Most people have irregular menstrual cycle. Some people may have hard time being pregnant, and also
or lots of miscarriages too.
Yeah,
sometimes,
so
if you have recurrent miscarriages.
Yes, but also dry skin. So dry skin is also another thing people forget about. That they'll say, yeah, I put my lotion all the time, but yeah, what if you don't put lotion? Then you're gonna be dry. Just like the hair loss, most people like just a normal for like everybody else. No, I mean it's not.
Or I'll have a lot of patients that come in like because their hairdressers tell them to come in. Like they'll be like, hey, maybe you should talk to your provider about this, especially if you've been seeing a hair person for a long time. This is us ladies, we're talking about this, but not as much. You, my darling. But I have a lot of patients that get referred by their hairdresser that they're like, hey, you may want to go get your thyroid checked because they're just seeing that they're not growing as much, or they're not having baby hairs as much, or they're thinner, they don't have to cut as much. So I get a lot of referrals that way, I would say.
And we cover more about under functioning or under activity thyroid, which is hypothyroid. I mean, you barely see hyper here and there. I mean, I pretty much have had maybe two people in my career when people have hyper. but they have more like high blood pressure, heart rate, anxiety, very severe anxiety, very skinny because
Can't tolerate heat.
metabolism is very far. You say you can tell they're very sweaty. So
It's more rare, I
it's
think,
more
than the
rare,
underactive.
and most of the people maybe they have a surgery after that, and then they become hypothyroid. There are few far between good provider out there who are trained how to treat it without having any biasing. And we always we give up our people choices to. Some people want to do natural. Some people want to take care with food. Um, and they do what they feel like doing. We're not showering any medication, but we will
We're
share
here to
what
provide options.
we share what our options are, what we have seen, what has worked for people, stories that I've heard about people improving. I mean, to me, my biggest story was someone was uh, suffered depression for 13 years and suicidal ideation, and just because she had one of the form of hypothyroidism. We're not going to get into specific what types. I mean, those are things we cover
in your visit.
In our visit, and they're just big medical terms. The biggest thing is to bring awareness of thyroid, and I can say there's a lot of women compared to men that have thyroid. And I would have anybody, especially women, be screened for thyroid for any physical.
But make sure you're appropriately screened. I think that's another.
I
think that's a difference too. Yes. That is something that we do differently than some other practices. Is sometimes when people say that they're looking at your thyroid, they're looking at only one marker on your thyroid. That's not a very specific marker, which is TSH. And you really need a full thyroid panel run to go ahead and give you a full actual look at what your thyroid is doing. And that's something different. I think as well too, for people that are already being managed on thyroid, but like, I just don't feel like it's working. I don't feel like I'm feeling any different. I think that's another thing too that gets missed a lot is providers that are not as willing to supplement active T3 thyroid. Yeah. Some people can't, their bodies just can't convert over that inactive form of thyroid that's in the synthetics to an active bioavailable form. And so sometimes you have to supplement that directly. And not as many providers, I think, are willing to do that. They're a little more gun shy about that. And I don't really know why. Like as long as you monitor it appropriately, like it's fine. It comes with training. It comes with training. That's true.
And that's true. When you have taken care of people and you have been trained and you see that it works, then you start thinking outside the box. 2 years ago, we thought we knew from school, this is how you treat thyroid, but we were totally kind of say wrong because people were not feeling better. So, but when we came back from the training up in Texas, then we look at thyroid way different. And some people, everything looks fine. It just, let's say, Kemi says, depends where the level is at. It can be deficiency versus you have real problem.
Yeah, deficiency versus insufficiency, and that there is a difference there.
And you can still have symptoms. I think the best thing is to listen to someone, which with a 5 minutes appointment and get out. You're not gonna get that being listened to. These are stuff we do in 25, 30 minutes minimum. To get deeper, and we have to know that your understanding of your symptoms is different than the provider. So you have to be understanding, what does hair loss mean, hair thinning mean? Is that what it is? So everybody got their own experience. So this is where we come in, where we are blessed to be a type of provider that we listen, just cool people, nice couches.
We keep going back to the couches because people keep asking us about them.
These are the best. And oh boy. And just not to be able to say, let's talk about this. Listen to somebody first and then discuss, share your medical experience, share their life experience. When the symptoms start, they put it together, do some labs, do some follow-ups. You gotta follow up the people, be available for them, and then help them see if this one works. Offer options. I mean, there's some plant-based synthetics replacement, but I would say thyroid, especially among women.
Get it screened, get it evaluated.
It's a big deal. It's a big deal. So
Mhm.
make sure you deserve a better provider who can think outside the box and listen to you how you feel.